So the Global Health Center is a think tank that is based in an academic institution of international affairs. We work together with WHO in a number of different ways. For example, we will collaborate with individual experts within WHO on research projects. For example, a number of WHO guest speakers will come and participate in our courses, teach our students, do advise WHO on specific issues, and we also study WHO. WHO is also a subject of study for us. And finally, WHO often participates and is a key stakeholder in a number of the meetings that we convene because, of course, they're always an important voice on policy issues. WHO is absolutely essential in the global health system. The system is a very diverse and crowded ecosystem of different players, and WHO is really right at the center of that ecosystem. And so the entire ecosystem, in my view, cannot function without a strong, well-supported, well-functioning WHO. It brings together the global community to discuss and to debate and to agree on ways forward to address critical issues such as the COVID-19 pandemic. There are a number of different ways in which WHO needs to be strengthened, but I think there are two that are really a priority. First is political support for the organization to play this leadership and convening role, and the second is in the funding. What is very important is that the governments give that political support to the organization to do what governments have asked, have mandated WHO to do. And that political support is not always forthcoming, especially when WHO needs to criticize or contradict or go against what a government sees as its own interests. And so I think first and foremost what governments need to do is to give WHO that space, that political space, to sometimes be critical of its own bosses, of its own funders in a way. The second major support that member states need to give to WHO is of course funding, because it's in the way that the funding is provided to the organization that will allow the organization in fact to take that arm's length position and to speak the difficult truths when it's important in the broader interests of global public health. And one of the big problems with the current funding structure is that it is highly fragmented and it's very unstable and unreliable from year to year. Many people have spoken about the size of the budget. My primary concern is actually not the overall size of the envelope, but the fact that WHO has thousands of little envelopes and it doesn't know how many envelopes it's going to get from year to year. And this makes the organization very insecure, both financially, but also this translates into the political realm. I think for WHO to earn and retain that trust, and that confidence and that arm's length relationship that will allow WHO to do its job well, it needs to be more transparent with all of its stakeholders, and it needs to put in place very, very robust accountability mechanisms. This is what will enable governments to, in fact, give WHO that policy space, that leeway it needs to do its work properly, which sometimes means taking very politically difficult decisions. Sometimes it means challenging very politically powerful players, including its own member states.